Welcome to the podcast series, Reducing the Risk of Severe Illness for Patients with COVID-19. This podcast is part of a micro-learning library on the testing, diagnosis, and treatment of severe illness for patients with COVID-19. This education is brought to you by the France Foundation and supported by an educational grant from Pfizer. Listen as Doctors Charles Vega, a family medicine practitioner from the University of California, Irvine, and Lisa Lancaster, a pulmonologist from Vanderbilt University Medical Center, discuss what to do and where to go following a positive COVID-19 test.
So we're recording this in July 2022 when we were certainly hoping that we wouldn't be seeing so many positive tests for COVID-19, but our center's positivity rate has returned back into the 30% range as of last week. And so we're certainly seeing a surge, a slower surge, but a surge nonetheless, depressingly. And so what we have to impart to our patients is, gosh, you have a positive test. And here's what it means. There's multiple things to do right away when you have a positive COVID-19 test. And more than you used to be, just isolate at home, watch for these symptoms or signs, and we're going to check back in with you. We have more options right now. And then luckily, we have Lisa here who's going to help us kind of walk through it. So when you get a positive test result in a symptomatic patient, what are some of your first steps, the initial things you would recommend to that individual?
Step one is we want to separate ourselves from others. We certainly don't want to spread the infection to anybody else. And that's what we call isolation. We use the term quarantine when we're exposed, but isolation when we're actually sick and need to separate ourselves from others. And we need to do that for about 5 days or so, definitely until the fever is gone for about 24 hours. Symptoms are getting better. And for the next 5 days, for a total of 10 days, if you're around others, days 6 through 10, you should wear a mask. Now, those people that are very sick or perhaps have a very weakened immune system, like a transplant patient, possibly may need to isolate longer. So getting advice from their physician may be certainly important at that point. Contacting your healthcare provider, because I think we all need to touch base with our particular problems, understanding our risk if we're a high-risk person or not, whether or not there are medications out there that may be appropriate. And just reminders that we need to monitor our symptoms of shortness of breath, oxygenation, fever. Make sure we tell our close contacts that they've been exposed and separate ourselves. Different room, different bathroom. If you have to get around others, put on a mask.
Yeah, those are all great points, and I think really critical for patients to realize right away. It's interesting now that so many patients are diagnosing themselves at home with home-based antigen tests, which can be a very accurate way to do it. If you have classical symptoms, especially when you have a contact and you get a positive test, it's very likely to be a true positive. We do have a difficulty with these tests because they don't have a perfect sensitivity. And so therefore, in those situations where it seems likely that COVID is present, I really encourage serial testing. If serial antigen tests over a period of 3 days are negative, it is very unlikely to be COVID. And then we have to think about what it actually is. We're seeing this trend towards non-temporal influenza and RSV. So those might come up. And those are important, notable infections as well, particularly in folks at high risk for complications, as you mentioned. And then getting evaluated for risk status and treatment, passing this on to the clinician is a good idea because I think we've maybe moved a little bit too DIY with this pandemic right now. Folks are on their second COVID infection. Well, I got through the last one okay, even though I'm 82 years old and I have 6 chronic illnesses. So I'll just test myself and isolate the best I know how, when I still want to be very much engaged, particularly in that patient's care, given multiple risk factors. And they're not factoring in that we have treatment options available right now, which could really cut their risk of hospitalization in particular.
Absolutely. And just the importance that if you've got symptoms that are highly suspicious and the rapid antigen's negative or subsequent rapid antigen's negative, get that PCR test.
Yeah, that's always a good option to have too, if they're at all available to go to a testing center or come into a lab. That's a really good consideration. I guess one thing is, so you say you've started them on treatment, say with an oral agent. What is your usual follow-up for folks who have above average risk for COVID-19? I know you see a lot of patients with interstitial lung disease, which is a risk factor for a complication of COVID-19. What's your follow-up schedule, currently in our age where we can actually treat the viral illness?
Well, we try to, at least our patients with lung disease, mild, moderate, and more advanced, advise them to just go to the drugstore, get a pulse oximeter. You can get them these days for $30 to $40, or order it on Amazon, and monitor your oxygenation. Monitor your symptoms of shortness of breath. If they're progressing, we certainly want to know, and we'll generally have our nursing staff touch base with them between 5 and 7 days when we think that courses may potentially have a risk of turning for the worse, especially in these patients that carry comorbidities that put them at high risk.
COVID certainly can have a variable course, but the classic is that all that inflammation that occurs on around day 5 to 7 of illness sets in, and then that's where the respiratory complications start. So folks who had a improving course of illness have a double sickening where they get sicker, particularly regarding respiratory symptoms and dyspnea in that day 7 to 8 time frame. So we really have to be careful about watching those high risk patients as well. And I have been using a fair amount of nirmatrelvir with ritonavir. And now we know there's this rebound phenomenon where patients can unfortunately develop increased symptoms after finishing their 5-day course of the medication. It seems to be that some people just need more, and probably if they're a little bit older and have more of that immunosuppression status, it's more likely they might need a second course due to rebound phenomenon. So that's something that I'm mindful of too. I don't forget that they still have COVID-19 just because I prescribed a very good drug that's an antiviral.
I think that's very true. And I think tolerance sort of plays into it as well, between stomach upset, nausea, and just not feeling too good when you take the medicines too in some patients. But some people tolerate it extremely well during their 5-day course. So it's just hard to tell.
Right. Yeah, absolutely right. And so, there are some basic things you want to lay down for patients and give them some counseling about before they initiate the drug. But in my practice, generally, it's been fairly well tolerated. But I know exactly what you're talking about. And I should mention that the rebound phenomenon does appear to be pretty rare. Most patients do improve between the nirmatrelvir and ritonavir, and then time. You get improvement in a lot of folks. Doesn't necessarily cut their symptoms a lot, which is what patients really care about, but especially for high-risk folks for hospitalization. I know that we're doing some good by preventing them from going to the ED and eventually, hopefully staying out of the ICU where you might take care of them, Lisa, because I know that's something that nobody wants. Any final thoughts on what to do with a positive test, things we didn't cover right now?
No, I think, the biggest thing as we move along through the course of this pandemic is just still being mindful that COVID can make you very sick, and be mindful of those around you. If you think you have symptoms, get tested. If you've been in close contact with somebody with symptoms, get tested. We certainly don't want to go spreading this to others as we are able to relax some of our masking and other techniques that we've been using throughout the pandemic. So it's kind of a balance with that, but we don't want to get too comfortable and get caught off guard.
Right. And the guidance has changed quite a bit. As you mentioned, you can, 5 days of isolation is acceptable now, but certainly that I wouldn't go to a big concert on day 6. I wouldn't recommend doing that. And travel is, I know, still, not recommended for the full 10 days, but just be mindful of others and think about where you're going and where you have to go and what you need to do, which is understandable, but also just for the stuff that could be more elective, maybe hold off for a few extra days, even if you're wearing a mask is a good idea. Lisa, this was a great conversation. I really appreciate you taking the time out of your busy schedule to join me in this. I also want to thank our audience. You're also very busy, and so it means a lot that you take the time to listen. Hopefully you found it very helpful to your practice, and please take care of yourselves and stay well.
Earn CME by clicking the link for credit. And be sure to check out the other podcast episodes in the library.